Thank you, Mr. Speaker. Misdirected bill, please vote no. Mr. Speaker, there are two issues that this proposal makes worse rather than better. One is more purely economic, the other is more practical, and you might say political. Let's consider the first issue first. Mr. Speaker, the great economist Milton Friedman said, "You can have a welfare state or open borders, you can't have both." Now, Friedman was actually in favor of open borders. He thought there should not be a welfare state. But, Mr. Speaker, implicit in what this proposal is trying to do is run against what Milton Friedman said and have open borders and a welfare state. Mr. Speaker, Medicaid is government-funded health care. It is part of the welfare state. I say that with no judgment. People who support it want a robust welfare state, and that's fine. But one of the cost drivers on our policy around Medicaid, what we call Apple Care, is that we are by design making the benefit available to people who can't get it through the federal government's purse. And, Mr. Speaker, that is primarily illegal immigrants living in Washington state. So, Mr. Speaker, what this proposal is trying to do is rearrange how we fund health care so that private insurance, private health care policies are taxed more heavily, and those funds go to support our Apple Care system, our Medicaid system, which, as you know, is a hybrid of both federal and state funding, so that the Medicaid rates can be raised. The rates that Medicaid pays to providers, doctors, and hospitals can be raised. But this effort to tax some, to raise benefits for others, is ultimately going to be ineffective. We will not be able to raise the taxes on private health care fast enough and large enough to cover the expansion of Medicaid to people who are receiving the benefit, but we can't give them the hybrid federal and state money. We're paying the whole bill there because by federal law, you can't give Medicaid resources, Medicaid benefits to people who are here illegally. We are in an indefensible, an unmaintainable system in how we're managing Apple Care and its reimbursements. Now, Mr. Speaker, we want to increase the reimbursements that we give to doctors and hospitals and providers through the Apple Care system. But by diluting it constantly, by opening it up, by spreading it out to more activities, we are inevitably draining the dollars that are there to reimburse doctors and hospitals and providers for the services that they provide. We need to keep our commitments, Mr. Speaker. We just spoke on the earlier bill about promises made and promises kept. We need to keep the core commitments in Apple Care focused on the core beneficiaries. The more we dilute the Apple Care money pool, the more we are in this intractable position where we can't pay the doctors and hospitals anywhere near the market rate they deserve for their services. This proposal doesn't fix that problem. It leaves the beneficiary pool diluted and is increasingly taxing a smaller and smaller universe of private health insurance to fund the dilution. And we can't even keep up with market payments to the doctors and hospitals, even with this additional tax. It's a house on fire, Mr. Speaker, and it's not We're not putting it out. We're dumping more gasoline onto the fire. Now, that's the economic argument. The practical political argument against this proposal, Mr. Speaker, is it's basically trying to game the reimbursement system. You've heard about it, this credit system that allows for federal dollars to match our AppleCare state dollars more effectively. And hey, listen, I'm all for gaming systems so we get more money out of the federal government, but I'm not sure that this proposal is actually going to get matched by the federal government. There's no guarantee of that, Mr. Speaker. And now you're going to hear some people say, well, that's because the federal government is taking money out of Social Security and Medicare and Medicaid. Mr. Speaker, that's not what's going on. The federal government is doing there what we should be doing here, Mr. Speaker, which is they are trying to focus the resources of government onto the core commitments of those programs, Social Security and Medicare and Medicaid. Now, we're not talking about Social Security and Medicare here, of course, Mr. Speaker, because those programs are strictly federal. But again, Medicaid is that hybrid. It's partly us and it's partly the feds. Now, Mr. Speaker, I believe that if we align with the good reforms that are going on at the federal level, we will be able to do what we seek to do, which is improve the monies that we pay to doctors and hospitals and other medical care providers through AppleCare and get them to the point where they'll accept AppleCare, where more of them will take the AppleCare card. That's the problem in my district, Mr. Speaker. We're giving everybody AppleCare cards and there's no place that'll accept it. So if we increase the repayments, the reimbursements we call them, the payments to the doctors and hospitals and other healthcare providers, by narrowing the scope of the program, more will accept that AppleCare card and my constituents can get their care in Westport and Aberdeen and Longview and Kelso and not have to drive to Tacoma or Seattle or somewhere to get care. Mr. Speaker, we need to marshal our resources more responsibly. We can't count on continuing to game the system with the feds because the game is changing back there. We've got to marshal our resources more responsibly here. We've got to increase the reimbursements by staying focused on the core beneficiaries. And by doing that, we will protect hospitals and doctors and other providers who aren't in Tacoma or Seattle, who are in suburban Washington and rural Washington. That's what we want to do. And on that level, Mr. Speaker, I think there is common ground among us here. But as others have said, it's the process by which we want to get to that end that we disagree on. This is a big issue, Mr. Speaker, and it's going to get bigger. We want to provide the services we promise to the people of this state. But we have to be disciplined in how we channel those resources. We can't give a lollipop to everybody. Vote no on this proposal, Mr. Speaker, and let's work together to find a way to fund AppleCare, to fund our portion of Medicaid, so that it is a valuable benefit to those kids, to those families, to those working people, to all the people who count on AppleCare to provide them their health coverage. Please vote no.